Okay, so let's see the next set. A parent brings a 10-month-old infant into the department saying, "My baby put a button in her mouth and now she is not breathing." So it's a 10-month-old infant and the baby has put a button in her mouth and is not breathing. So it is very emergency, isn't it? After the nurse determines the infant is not breathing, what should be done next? Perform the helmet maneuver, initiate cardiopulmonary resuscitation, administer 4 back blows, administer 4 thrust midline on the patient back. So see, to answer this question, you should know about cardiopulmonary resuscitation. You should know the first aid of choking. We have a separate class on this. So once you attend the class, it will be easy for you to answer this. So this is important, okay, in your traumatic view also, first aid of choking. An infant arrives in emergency department, not breathing and does have a pulse. There is no breathing, okay, breathing is not there and it have a pulse. When starting CPR, where is the correct place to assess for a pulse in this patient? So so you're going to start CPR. The patient doesn't have a peripheral pulse. So where? Carotid, radial, brachial, temporal. So anyways, it is not temporal. It is not radial. Now the confusion is between brachial and carotid, isn't it? So when starting CPR, it is about when you are going to start cardiopulmonary resuscitation. For an infant, the answer will go as brachial. Okay, for brachial. For an infant, when you start CPR, it is brachial. A 5-year-old patient who underwent abdominal surgery suffers from fluid volume deficient related to nil per oral. So intravenous fluid therapy is given for hydration. Which of the following indicates the treatment is effective? So for decreased urine output, for decreased fluid, if you have a good skin turgor, yes, this is the answer. Urine output of 15 ml per hour is less. You should have for 30 ml per hour. And respiratory rate is 35, no. Heart rate of 100, no. It should be good skin turgor. That is a very easiest question. A 7-year-old child is brought to the physician's office due to sudden onset of bright redness on cheeks. The nurse observes that the child has a temperature of 38 degrees Celsius, 100 degrees Fahrenheit, with chills, and which is the most likely diagnosis. So the patient's cheeks has got so much redness. So redness is there in the cheeks and there is elevated fever. Fever is high, that is 38 degree. So it's the most common answer is, so when you have the redness starting in the cheeks, it is fifth disease. Okay, it is fifth disease. Rotavirus is diarrhea. It is not Rosealla infantum. It is fifth disease. A nurse instructs a community education class on breast health. Which statement best described understanding of the appropriate age to start screening mammogram is a woman of average? So if a woman is at of average risk, and at which age, that's a question, okay, at which age you should start doing mammogram yearly? So the answer is at 40 years old. At 40 years old, women should start doing mammogram yearly for screening against breast CA. So the answer is 40 years old. A patient is taught how to perform a breast self-exam by a nurse. Which statement is best described as understanding of proper procedure for doing the self-examination? Use the palm of the hand to feel for the lumps. Apply 3 different levels of pressure to feel the tissue. Stand when performing exam. Perform exam annually. Anyways, this is wrong. It is not annually, it is monthly. Stand when performing exam. That's not the position. Apply 3 different levels of pressure. Yeah, you should have a deep palpation, mild palpation, and a superficial palpation. This is the answer. Okay. While caring for a child with effective airway clearance related to increased mucus production, the nurse should encourage. So, why do we encourage fluids? We always encourage the fluids to more fluids. Why more fluids? We give more fluids for thinning the secretion. Thinning the secretion. So, we should give more fluids to thin the secretions. A 59-year-old patient with lung cancer and metastasis to the bone is in the hospital for pain management. So, the patient is 59 years old. He is having CA lung and he is in pain management. The patient rates the pain 10 on a scale of 0. So, it is like the patient is having 10 by 10, which is severe pain. Pain 10 on a scale of 0 to 10. The best goal of the nursing diagnosis of alteration is comfort is that the patient will show no objective signs of pain, no complaints of pain. The patient will say, I have a tolerable level of pain. This is the answer, okay. So these are the kinds of questions where directly it comes from fundamentals. So see, you have a patient, the patient now is giving you a score that it is 10 by 10. My pain is 10 by 10. So when you frame a nursing diagnosis, so what is your goal? Is it that the patient will not complain of pain or the patient will have a tolerable level of pain? No pain. If you say it is no pain, that will never happen. Pain will be always there for this patient. Why? Because the patient is having lung cancer and there is metastasis, isn't it? So no pain can never be an answer. It can be tolerable pain. The patient has pain, but he can tolerate. That will be the answer. A patient with advanced lung cancer is exhibiting cyanosis and edema of the head and upper extremities. So the patient is having lung cancer and the patient is having edema of the head and upper extremities. Which of the following intervention would most likely provide an immediate benefit for this patient? So the patient is having cyanosis. So whenever the patient is having respiratory depression or cyanosis, and when there is edema of the upper extremities, always it is advised to elevate the head of the bed. Okay, elevate the head of the bed. Even I told you in another class, 45-degree elevation, 40-degree elevation. These are the common questions which is asked. Okay. If the patient develops complication during a blood transfusion, the nurse first should be, it's very easy. The patient is having a blood transfusion. The patient is having a blood transfusion. Okay, the patient is there, blood is flowing. First thing, the patient is developing rashes and the patient is showing signs. It should be stop. Stop blood transfusion. That is the first thing. You stop the transfusion. Then you see, this is also there, this is also there, this is also there. Everything you should do. The first thing is you stop the transfusion. Okay. Which of the following types of healthcare service is an example of primary levels of care? So you have got 4 options. So you have 3 levels of care, isn't it? Primary, you have secondary, you have tertiary, and even you have quaternary also these days. So in this, primary prevention is which one? primary prevention is immunization. So we have a separate class for this levels of care and prevention and all. So please follow the class. Okay, so that's it for the time being.